Okay, right. So this is another one of my scenarios that I've had. Okay, so you're seeing a 47-year-old chap. You're on call this time. You're the surgical SHO. Okay, you've gone to the vascular ward and he was admitted the night before for endovascular aneurysm repair. Okay, he's recently returned from a flight from Spain. He's very short of breath and he's requiring 10 liters of oxygen. The nurses give you this parameters on 10 liters. So already we know this patient's sick. Okay, respiratory rate is 27. You can hear some bronchial breath sounds on the left side. Okay, and this is his blood gas. Okay, so have a look at this blood gas and have a look at the scenario. So in the chat, have a think about it. And I want you to tell me what you think of the gas, but also what you think could be the diagnosis. So you've got a chap who's coming for an elective admission, so he should be well, but he's not. And he's coming for a repair of his aneurysm. He's recently come from Spain. He's requiring a lot of oxygen, but you also have bronchial breath sounds as well. What's going on with this patient? Okay, so we've got a type 1 respiratory failure, someone's typed. What else is going on? What's the diagnosis, do we think? Okay, PEP. Pneumonia, differentials, PE, pneumonia, yeah. We've still said type 1 respiratory with EQ mismatch, normal pH, probably due to left cap. We've got pneumonia. Yeah, okay, right. So they're really good differentials. Okay, so I agree. I think the more likely diagnosis is pneumonia, but certainly with this patient, you would be thinking of putting them through the scanner to make sure there is no PE. I think going off the kind of examination findings, we've got the kind of bronchial breath sounds on the left, which would put it into pneumonia. But as you can see, sometimes, they might also have a PE as well as a pneumonia. But that's kind of the thing, that sometimes patients don't just come in with one problem; they come in with three. He's come with an aneurysm. He's also come with bronchial breath sounds, and he's also very hypoxic. So it would be sensible to I wouldn't object to this patient going under the scanner, providing they're well enough to go under the scanner. Okay. I think let's go through the scenario. Let's go through the breakdown. Okay, so what is the PO2? Okay, so the PO2 is low. He's on FiO2 is 35. So I think we asked about the AA gradient. It's useful, but we already know the fact that this patient's got they're hypoxic, that there is a AA mismatch. What is acid-base status? It's normal. PCO2 is low. And let's try and answer why the PCO2 is low. Well, his respiratory is 27. Okay, he's poorly. His bicarb's normal as well. Okay, so we've got a normal pH with this low CO2, not enough to cause acid-base disturbances, and we've got a normal bicarb. So there's no compensation. Iron gap's irrelevant for this. So we've got a patient who's in a type 1 respiratory failure with a normal pH, most likely due to, with a low CO2, most likely due to hyperventilation, secondary to a possible pneumonia, but I would agree that a PE would need to be excluded in this scenario. Certainly is not fit for his repair and would need to instigate treatment. What I do want to mention, though, is the base excess. So the reason why I put the base excess is -2. Okay, that's normal range of base excess. And the base excess is basically what it says in the tin. Okay, so it's base excess. Is the excess base or not? In this case scenario, the base is low. Okay, so you do wondering whether there's if there's developing some form of acidosis if they're developing it. Okay, so it might be sensible in this patient, obviously, to instigate antibiotic therapy. You might want to give treatment dose clexane, but also you might want to consider, if the fluid status allows, to give us a bit of fluid as well as part of response to infection. because the basic success is slightly on the negative side. So that's really important to kind of consider. The basic success. It's one of the things that's often missed, but it can also help you support what's going on and gives you that extra bit of information to support your patient. Yeah, we've got the fact that the pH is normal, but the basic success is slightly negative. You might want to consider some fluids as well to help this patient. Okay. Are we happy with this scenario?